Namaste everyone. I am Dr. Madhav, radiologist residing in Bengaluru. For some time now, I have been weighing on the thoughts about the ways to bring medical fraternity much closer to the community. I also come across individuals who achieve considerable things that enhance the lives of fellow human beings. I wanted to introduce these success stories to all of you. The best way of doing this would be hearing directly from them. The idea behind this series of interviews is to recognize and celebrate each success around us. These are the people who toil their lives with goals to make this world better. These are common heroes who matter to us and who make the difference. These are the people who prefer to be judged by their deeds, the ways they were achieved, and the values behind it. Let us celebrate success with values. Welcome to my show, LifeScan with Madhav. Hope this would inspire many more amongst us. Hello and namaste everyone. Welcome you all again for yet another episode to celebrate success with values. Today we have our eminent physician, Dr. Raghuram NK with us. Dr. Raghuram was born in a small town of Sagar in Karnataka, and for more than a decade, he has been practicing in Bengaluru. Dr. Raghuram, welcome, and we would like to hear more from you with a brief introduction. Dr. Raghuram, please.
Thank you, Madhav. It has been a great pleasure to talk to you on this platform. I hope in the next 20-30 minutes, which you are going to engage with me, will be more fruitful. It will open the way I see the world, the way I traveled through my life journey, and would like to share those things with you. I'm just eager to hear from you how you are helping all the people around to know the pulse of all these small, uncelebrated or little celebrated people. Thank you for that opportunity.
Thanks, Raghuram, again. To begin our conversation, I'm sure each one of us would have our own story. And in your case, just want to know how you chose to be a doctor. Rather, what inspired you to take this, I would say, a challenging profession?
Yeah, for many of us, you remember, Madhav, most of us have only one thing in our mind that from the childhood, we need to study well. That was the only weapon we had in our hands. Other than that, there was no backing as such in terms of economy or any other parameters. But again, for me, when we entered second PUC, it was more like I was tuned towards going to the medical field because already my two elder brothers were already into this profession. So it was more like for me, I have to choose, I have to go along this. In fact, I didn't concentrate much on the engineering side during the counseling also. So once you got the seat, it got over. For many of our batchmates, it was a dilemma whether to enter into the medical field or engineering field or any other field which they like. So for me, it was more, in fact, tuned towards going into this. But even then, if you look at our own family, there was no doctor as such in our family. So our brothers were the first to enter into this profession. And of course, things have panned out well for us. We certainly are grateful to God to come to this profession. God has chosen us to serve the people through this profession. Very happy to do that.
Thank you, Raghuram. Nice to hear about that. And second question is, once you start your medical graduation, the interesting thing and the challenging thing is always the dissection table. And how challenging was for you to deal the dissection table or the corpse, would be happy to know about that.
Yeah, there is always a curiosity for non-medical professional to see like how the a corpse is kept on the table, how it is brought from the tank. You remember, Mother? So they used to keep it in the tank. From there, they used to bring it on to the table, and the whole class was divided into 7, 8 batches of 8 to 10 people, so that they can do the dissection on the particular part. So we had upper limb dissection, lower limb dissection, abdomen, thorax, head. So each was a good experience for us to know exactly what actually inside is there, rather than looking at only the pictures. So you tend to write a lot of diagrams in anatomy, anterior, posterior. These were the words which are new to us. If you remember, lateral, these words were a little bit new to us. In that way, when you look at actually in the dissection and you appreciate those features, the position of those organs, the position of those blood vessels. So it was really great. And as for the fear factor, which one generally tend to associate with the corpse, I think that was not there much with me, to be frank with you, because I had seen those things in my 10th standard. I had this opportunity to visit the medical college at 10th standard. There was a program called Carmex held in, I think, 1991 in KMC Hubli. It was organized, and I had the opportunity at that time to visit the college in my 10th standard and see all those organs, those dissection tables. I had that opportunity to see them. So in a way, it was a bit okay for me to go ahead. And we had good teachers to teach us. It was a wonderful experience, definitely. We had hands-on, very important. Nowadays, I heard anatomy was taught more like the tutor will dissect it out and keep it, and students had to read. It was not the case with us. We used to dissect skin, subcutaneous tissue, going further, tracing out all the branches of the nerves, the blood vessel branches. It was very nice, actually.
So, Raghuram, you never had the fear of dissection table, because it's
Yeah,
common that many a time students quit MBBS and pursue their other interests, just for the fear of dealing with the dissection table.
yeah, sure. But the only thing is, if you give a glimpse of what is there actually, I think that fear can be easily taken out. That fear is more for a non-medical person, I feel. When you don't have any knowledge or have never seen anything like that, then obviously it may be there. But it didn't happen in my case.
Maybe, as you said, your earlier visit during Carmex, or maybe you had already a couple of doctors in making in your family that might have helped you in your case.
Definitely.
And following that, Dr. Raghuram would like to know what made you to pick your specialty, general medicine, later point of your career.
Um, Actually, when we, all of us wrote exams post our MBBS, we had many branches to choose. But at the end of the day, what I felt is medicine is something that touches every lives you come across. The largest population that is living on the earth, including India, is above 18 years. You see the amount of population. If you divide the whole population by age groups, largest group is above 18 years. So if you have to give some healing touches to people, then you have to obviously look at the largest basket, and that largest basket lies in medicine. So there are a lot of branches, including radiology, pathology, or any other branch you choose. Again, they go limited. But if you want to give a healing touch to the maximum number of people in your lifetime, that is simply goes through medicine. So general medicine. So I that made me to choose this branch, and I had the vision that whatever God has given me this life, So we have to make sure that that is taken well by giving maximum help to all the people around us.
And recently, I came across the news that few of the seats have remained vacant, even following the last rounds of NEET counseling, few of the postgraduate seats. So, what is your take on that? So, is it
Very,
indication
very
that some sort of
nice.
dwindling sign of enthusiasm towards medicine and the post graduation following that?
It's a very sad state of affairs. If you can recollect, we had definitely had a 50% cutoff during our times. It was there for very long period that was unchanged. Particularly, I'm not very happy with a lot of colleges getting autonomous and building their own curriculum. And at the end of the day, it has got more to do with economics rather than teaching. So in a way, if you see, there should be some merit always when you write exam. So if you don't want to give any merit to the exam, there is no point in writing the exam itself. The fact you are writing an exam is to ensure that you have to pass in some way, whether it is 30% or 50% or 60% or 80%. So that you can keep arguing what may be the best thing depending on all other circumstances. But again, there should be some sort of cutoff has to be there. It can't be zero cutoff, which I didn't like. I think most of the doctors who are practicing, who are into this profession, know that in the long run, if you keep doing it more often, you are going to create people who may not deserve this field, and the end result you can see in terms of quality of care those people are going to give to the society, it is going to come down. So they may employ few more doctors and get the job done through them. That's a different issue. But at the end of the day, in my view, whoever qualifies to be a doctor has to be good. So ultimately, the whole purpose of we becoming doctors is to serve the people. If that and that has to be served well. It's not just that I treated a patient. I have to be very efficient in treating. I have to improve every day myself. I want to see the whole batch of doctors getting improved every day, and that has to translate into better healthcare overall. If you see community healthcare and even at the national level, if you see that has to improve. So if you make the cutoff as zero, so there is no point. In the long run, it is definitely a double-edged sword. You may give a number of reasons to say that we are going to fill the seats which are vacant, otherwise no one would have occupied it.
Dr. Raghuram, so you are suggesting some kind of merit standard must be adhered to during the selection of either MBBS or post graduation courses, and even of course I do concur with your thoughts on this. And now I would also know your I would say challenge, how you dealt with or how difficult it was to overcome the days of COVID, both from the professional front as well as from the personal front. How challenging were those COVID days, stretching for the period of 1.5 years. And as I said, it is not only the career as such or the family as such. All of us, we had seen economic impact of COVID together as a part of the society. Would like to hear more on this from you.
Yeah, it was. You remember, Madhav, we never had thought about something like a pandemic. So it was a question we were asked in microbiology, if you remember, what is an epidemic, what is a pandemic. So we just used to read that, okay, epidemic means lot of population is involved. Pandemic means many countries are involved across globe. Like that, we used to read mainly for answering a microbiology questions. We never had thought at that time that something like this would come to us actually. In that way, it was very new to us. Hope we will not get something like that again in our life. And as such, we were very ignorant about something like these kind of viral infections with so many lives being lost. It was very painful experience. First time I realized that you told why you took general medicine. So this was the occasion for us that was justified that we could help so many people across Bangalore and across many other places where we did even online consultations, and we could help them literally. And among all the branches, I'm not boasting, everyone chipped in to the maximum, but the maximum brunt was taken by physicians at that time. So, and we were unaware like how the viral infection spreads, how though we used to read from stories from China, stories from US and other countries, European countries, how the things would be, yet it was I was asked to even give a lecture on that. We didn't have had at that time seen any COVID case. We just took the glimpse from there what they used to do, and we used to give tell our friends like this is what it could be like that. But when actually it came and we landed up, the first test, I still remember the first COVID test I wrote for a patient. So it was all new experience for us. And first wave, literally, we didn't know, like there was no guidelines to say like which you need to treat. I think 1 month down the line, we got some guidelines from AIMS saying that you need to categorize, you need to give oxygen. I mean, so many things came up, role of steroids. So one after the other keep us in line for a better treatment for those individuals. But it was very scary. Like it was not just that any other viral infections which otherwise we used to treat more often. So the problem with COVID was the onset and the progression. Progression was the one that was it took us it shook every one of us, because most of the times we expect viral infections to be in upper respiratory. It goes up over 3 to 5 days or maximum 1 week. But the problem here in COVID was it used to go to the lungs. So the alveoli getting involved. So it was basically a lower respiratory tract infection. It was involving both the lobes of the lung. So it was in a way it was unpredictable course that was much more. When you sit in OPD, like people used to queue up. Actually, it never happened as such. Though we used to say maintain social distance, all these things, but in a hospital setting, when they come, it was very difficult. So we used to plan everything. Like for example, if there is a set of 3 chairs in a row, so one chair used to be blocked so that no one will sit there. So all these small things needed to be planned, and we did that. Of course, as a protection, first time we used to wear a lot of jackets, glasses, masks, headscarf, so many things we used initially. We were also unaware like whether if we get infected, what to do. So all these problems were always there. But one thing we kept, I mean, reminding ourselves that we have chosen this profession. Let us make an impact when there is a need. So, and we decided to choose because at that time there was a scare among the doctors also that don't go and treat. You may not earn, that's okay. Just keep aside, let the things flow out. For the initial days, I'm talking, not about in the second wave or the third wave. First wave was totally unknown to us.
Yeah,
So there were,
absolutely. It was that
yeah,
fear of unknown. I mean, we
yeah,
never
fear
knew
of
the
unknown. Yeah.
pathogen, much about the pathogen.
Many people did not treat actually in the first wave. So it was, but somehow I thought, let me venture, because we are actually took this profession basically to serve, and we'll see like best what we can do to the patients. Though the treatments were limited at that time, the first wave, considering the colchis in various kinds of drugs we used. But again, the fundamental thing is the personal, each person was different, how they behave to the virus. So it was what we realized at the end of the first wave is that rather than virus actually attacking the person, it is actually the response by the person to the virus matters most. So that was the lesson we learned. And if you can control the response by the body to the virus, you stand a better chance to save the patient. So that's how where the role of steroids and other immunosuppressants came into play. And yeah, so that was good. And of course, many doctors lost their lives. People don't remember that they sacrificed their life. So it's not very easy to sit and say that, okay, the things came, you are paid to do this job. That's all different. But when you actually sit in the war and treat, it's not easy. It's not easy. So many of us don't know that we actually stayed separately from our house. So actually, I had taken an apartment just above my apartment for rent for a month, and I stayed there. I used to come down. I used to watch separately. I had a separate bag of uh, clothes, everything for myself. Only during the food time in the night, I used to come out and take a plate and go up and eat. So that was the thing. So we were actually isolating ourselves so that our families are protected. So that was not an easy thing. So things have passed, but that's how it was. First wave.
So it
And
was a rare
yeah,
occasion where both the patient as well as the doctor's lives were at stake. And Raghuram,
definitely.
just extending our discussion on the viral infections, though COVID is gone now, but seasonal viral infections uh, keep on occurring. And how often you take a chest X-ray in case of suspected routine viral respiratory infection?
Yeah, many a times investigations like chest X-ray or even the CT for that matter may not be required in general for every respiratory infection. So all that we do is we assess the vitals of the patient. If the vitals are holding well, for example, his BP is normal, his pulse rate is normal, his respiratory rate is normal, his oxygen saturation is good, the patient is well oriented, he's talking sensibly, he can understand. I think there is no need to rush through these investigations now actually. So during COVID, it was a different time. The time from the time of onset of infection, the course can be very fast. So we need to make the diagnosis quickly and act quickly. So now actually, when we are practicing in OPD, we are not subjecting everyone to chest X-ray or CT. That's not the case. So if somebody you come across with saturation being low, less than 90% or 92% consistently, definitely there is scope to do a chest X-ray, or I would urge better to do CT itself because it will give you a better diagnosis.
And is there any occasion wherein, say, in case of similar infections, either bacterial or viral, patients would ask for an antibiotic, but as a physician, being aware of antibiotic resistance, would you keep them,
Yeah. Yeah, generally we try to avoid antibiotics for the first 3 days at least. That is the practice we generally do. First 3 days at least you hold on the antibiotics. So fourth day, fifth day, if the patient continues to have symptoms, and your lab parameters should be ready by at least third day at least, if not on first day or second day. If the lab parameters do not show a direction towards a viral infection, you may be justified in starting a course of antibiotic. That is a practice, but first 3 days definitely not required. Most of them recover actually without an antibiotic. There is no need to keep a blanket antibiotic for every respiratory infection. That should not be the approach. And a simple rule like you look at the WBC count, you look at the platelets. So if there is a drop in a WBC count, if there is a drop in platelet count, so maybe we are dealing more towards a viral infection. So you can just know through the lab values whether we are dealing with a viral infection or not. And and also the course of the illness is also very important. If suppose you see on day 1 versus day 3, if there is a rapid progression in the symptomatology, or if somebody's saturation is 96%, 97% on day 1, and day 3 if suddenly find 90%, those things we don't see in bacterial infections. So it is rapid progression is always common in viral infections. See, we have basically two lobes, or rather three lobes of the lungs, and at least we can maintain saturation with half of our lungs itself, a normal saturation. So if saturation has to come down, it has to have a significant involvement of the lung lobes. So that kind of picture you won't get in a limited time span with a bacterial infection. So these small things you can clinically make out from the history, from the examination, that what you are dealing with is a viral infection rather than a bacterial infection. And 1 to 3 days, I would urge everyone not to use an antibiotic. From day 3 onwards, you have the discretion of using a course of antibiotic, provided you have some lab values backing it.
One generic question, but a tough question to answer, Dr. Raghuram. It's all about the professional stress and work-life balance. So how are you able to manage it now?
Yeah, on one hand, we have to earn for ourselves, for our families. So we need to see the patients. But on the other hand, we keep telling every patient that, doctor, what should I do to improve my health? What is the best mantra for me to live till 90 years, 100 years? They keep asking these questions, very relevant questions. But again, if you see, when we preach them to do exercise at least half an hour to 1 hour every day, do 1 hour yoga, take 8 hours, at least 7 to 8 hours of sleep. All these things are applicable to us also. So it is very important that we are also human beings. At the end of the day, I might be a doctor, but at the end of the day, I also have a lung, I have also a heart, I have a brain. The same, something similar I share with every one of you. And I also need the same pattern of a living which I'm teaching to others. So in that way, it is very critical that you keep yourself more fit, more energetic by employing these strategies which we are going to advise to the patients. And yet, what I have seen in my life is, you employ this, you will be more energized to see more number of patients also. So that way, I think you can balance. Never leave any of those important things like an exercise, a good amount of sleep. These things, never compromise on them. And
So this is
Madhav, you would definitely agree that there is a survey, I think, conducted on the doctor's lifespan. It's actually shorter than the general population. The simple reason is that doctors are at more stress than other population in this world. So definitely, it's a wake-up call for all the doctors, no matter how busy it is. Make sure that carve out some time for yourself, some time for a regular exercise, that good healthy eating pattern which we advise and cherish, that we know that knowledge has to transfer to us also.
so this is one condition then where both patients and doctors share the same prescription.
Definitely.
And Raghuram, yet another question I have, rather I would say, having a fulfilling career, how strongly you recommend a medical career for the youngsters?
Definitely, like you have to be committed to this field. The first and foremost is, don't come to this medical field thinking that I'll make this much of money. I'll be crorepati by the end of 30 years, 40 years. So don't try to equate our profession with some amount of earning. Rather, I would say that. Money will just follow if you stick to the ethical practice. Money will just definitely follow to all of you. So be committed to the service of the humankind and enter, and definitely the rewards are there.
Good to hear that, Raghuram. And now let us move on to some general questions. And of course, being a part of the society, we need to see all the changes which happen in the society. And neither medical field nor the politics around is immune to this. So one question I have, who is your favorite politician, Dr. Raghuram?
I think that I don't have any doubt on this question. So my role model is always Narendra Modi. So the way he has worked tirelessly for all of us, I just want to imbibe that quality from him and serve better. And there is no words to describe the way he has conducted himself for the good of the people. I know there are a lot of criticism people keep making on him. So he definitely follows the path of karma. If you remember what Krishna has said, that you do your job, leave the fruit to me. So I'm the one who is going to give you fruit. So you just do your job. So that's what Krishna has told, and he's certainly following that path of karma. And I would urge that everyone else should follow that. And that is the essence of life. There is no mincing of words there. Definitely, that has to be the goal in our life.
Thank you, Dr. Raghuram, for your time and also answering all the questions from medicine to work life balance and to politics.